Let's continue our discussion on dizziness with the pattern kidney essence deficiency. Kidney essence deficiency has the following clinical manifestations: persistent dizziness with a feeling of emptiness in the brain, tinnitus, depression, exhaustion, waking up during the night, poor memory, sore back and knees. The tongue is pale if yang deficiency and without coating if yin deficiency. The pulse is deep and weak if yang deficiency and floating empty if yin deficiency. This is essentially a deficiency of kidney essence. The essence is failing to nourish marrow and the brain. This results in a deficiency of the sea of marrow, one of the main symptoms of which is dizziness. As the essence has both a yin and a yang aspect, its deficiency may manifest with symptoms of either kidney yang or kidney yin deficiency. This is a common cause of mild dizziness in middle-aged and elderly patients. The treatment principle is to tonify kidney yang or nourish kidney yin and strengthen the essence and nourish the sea of marrow. The points we can use are RAN4, kidney 3, bladder 23, bladder 52, SI3, bladder 62, DO16, DO20, DO17, and GB39. RAN4, kidney 3, bladder 23, and bladder 52 strengthen kidney yang or yin depending on whether moxa is used or not, and nourish the essence. SI3 and bladder 62 is better for kidney yang deficiency and strengthen the governing vessel and nourish marrow and the brain. DO16 and DO20 are points of the sea of marrow according to chapter 23 of the spiritual axis. They stimulate the rising of qi to the brain and nourish marrow. DO17, called brain window, nourishes marrow and relieves giddiness. Gallbladder 39 is the gathering or waypoint of the marrow and therefore nourishes marrow and relieves dizziness from kidney deficiency. We have here a case history of a 31-year-old man who had been suffering from severe dizziness, slight deafness, and tinnitus for 1 year. His condition had been diagnosed as Meniere's disease. He sometimes sweated at night and felt generally exhausted. He had a previous bout of dizziness 10 years earlier. He also suffered from headaches and of a throbbing character in the temples when his eyes would flicker. His tongue was slightly red and the coating was too thin. His pulse was empty on the deep level and wiry on both rear positions. The diagnosis: this is a clear case of kidney deficiency with the night sweating, exhaustion, tongue without enough coating, pulse empty on the deep level, and liver yang rising with a throbbing headache, flickering eyes, and wiry pulse. Thus, this is a combined condition of deficiency of kidney yin and excess of liver yang, which is liver yang rising. The dizziness and tinnitus can be accounted for both by kidney yin deficiency and by liver yang rising. So the treatment principle is to nourish kidney yin and subdue liver yang. Thank you for your attention.